Are you in every way, woman?
Every Way Woman presents What to Do After a Breast Cancer Diagnosis.
1 in 8 women will be diagnosed with breast cancer. In 2012, Dr. Mimi Kapoor came and she told us that would be one of us. Last week, they found an abnormal lump in my right breast. Dr. Curcio, what do I do?
Well, I think you start off finding a good team. You have to find your physicians, and I think that's the hardest part in the beginning, because like we were talking about before, is who do you go to? Who do you know to trust? Do you look on the internet? Do you talk to people? Do you ask your primary care doctor? I think over and over again, some people do go based on their primary care doctor's recommendations, but a lot of people talk to women that have been through it, and they say, listen, I went to this person and I had a good experience, and they took really good care of me. So you have to kind of, like you were in a sporting game, you have to find a team that's going to be up against the breast cancer with you. It's going to be standing there shoulder to shoulder with you to fight if there's anything.
So you have all these emotions going on, right?
Right.
And how do you not automatically go to, oh my God, I'm going to lose my breast. Oh my God, I'm going to have radiation. I'm going to lose my hair. How do I manage those emotions to just get to the next step, which would be the biopsy?
Well, I think the way you manage it is you just stay busy. You just kind of do what you do every day and try not to think much about it.
Is that okay, though? I mean, to just distract yourself?
Right
Are you
now,
not being honest with yourself or
and not just
embracing
me,
it?
every woman that's in this place like me right now.
Trust me, I know this. But you just got to stay busy. I mean, because there's going to be a certain amount of time between the time that you find out you need a biopsy and the actual biopsy, and then you got the time.
How much time should you allow?
Well, I think within a week to 2 weeks is reasonable.
That quick? Because you hear of so many women who have to wait for referrals and months before they can ever even get in to a doctor.
Right. And that's difficult, and it might get more like that as we move forward, with a more socialized model of medical care. But really, in most PPO, private insurances, usually we try to get patients in within 2, sometimes 3 weeks. We do try, because we understand that you're sitting home going to the worst case scenario. So we're trying to really work with you to get this, answered.
What are the questions that we should be asking at this point? What should I be asking you as my doctor?
Well, I think, number one is whoever examined you and looked at your mammogram, how suspicious is this? And number 2 is, a little bit about family history. Do you have risk factors that might make this more likely to be something? And then, really, then you just have to get yourself in a mental position that you're going to go into this and, it's going to be whatever it is you're going to be able to deal with. And you're going to...
Is there different types of breast cancer?
Oh, absolutely. Yes.
I didn't even know.
There's many different types of breast cancer. There's 4 main subtypes. And, the first 2 are a little less aggressive than the other 2. And there's some breast cancers that we treat at a very small stage because they're biologically more aggressive. They're of that aggressive subtype.
Speaking of the stage, does the stage that it's found at determine the nature of the treatment that you recommend?
Well, that's a very good question because it used to be that stage dictated a lot if you needed chemotherapy. Mm-hmm. But now that we understand more about the biology of breast cancer, 10 years ago we were treating all breast cancers the same. Mm-hmm. But now that we understand that biologically there's some breast cancers that'll grow for a long time in the breast and never become cancer. And there's...
sorry to interrupt you here, but I want to get back to quickly the beginning of this and having someone who's so near and dear to my heart. Stacey, be going through this process. I want to know, as a caregiver and as a support system, what can we do to help her? How does she prepare for that first appointment in going into this treatment?
I think, you just have to gather the people around you. A lot of people want to just kind of hide and not let people know what's going on. I think you gather your support system around you.
But, there has to be more than just gather a support system. Like, what is the plan of action? Do we need to write down questions for the doctor? Who does she need to bring with her to the treatment?
At this point, she just needs to find out what it is. It could very well be a benign fibroadenoma.
Well, in the case it is cancer. What do you
then
do?
You go there. Don't go there, but don't put the horse before the cart.
Right.
A good percentage of breast biopsies are benign. So if you have a breast lump, it's not automatically cancer.
What is benign?
It means it's not cancer. It means it's not something that's life-threatening. And a lot of times breast biopsies are something that don't even need to come out. It's something fibrocystic changes or fibroadenoma, which is a tumor that's benign, and you could follow it. You could take it out.
So it's okay to have a tumor in your breast that isn't cancerous? You don't have to take that out?
You don't necessarily have to take it out.
Can that become cancerous?
Not usually, no.
But one of the things that I'm encouraged with, and I know other women are watching my place, to encourage all of the information that is out there. And I think that it's come a long, the breast cancer's come a long way. And so it's not a death sentence anymore.
No.
And so while I'm a basket of emotions, I'm encouraged by the information that's being put out and by women like you.
Stay strong, Miss Stacy. With more breast link and great advice from the doctor's perspective, we'll be right back with Every Way Woman. Stay tuned.
Are you in every way woman?